According to basic antenatal care plus, a pregnant woman needs to have at least 8 antenatal visits.
It does help because of Gunama awareness. There are things that they know that we don't know. Let's just check out, we understand that there's a reason why all the time when you attend because they're checking something.
Ngilandela ama procedure wabe clinic and ngenza sure ukuthi ngidla health njengoba besho.
As pregnant women, somehow, somewhere, you are too emotional. So meeting with people who are also going your journey, it's something that helps because of ngiyakhuluma about inkinga zenu.
When should a pregnant woman start antenatal care, and what should it be like in the first 3 months of your pregnancy? Hello and welcome. I'm your host, Dr. Mosam Tombene, and signing with us today is Atia Asma, with the feeder interpreter being Caitlin Nair. On Vital Signs, we focus on pregnancy and childbirth. Pregnancy Awareness Week is observed from the 10th to the 16th of February, and this year the focus is on antenatal education to promote healthy pregnancies and safe motherhood. Coming up in the program, we'll listen to an insert produced by Wandile Mufugeng. He spoke to a nurse from Alexandra Clinic who is operational manager about the services that they offer. He also spoke to personal trainer and nutritionist about the simple exercises that pregnant women should do and can do whilst they're pregnant. We speak to a gynecologist and obstetrician about pregnancy as well as childbirth, and then we'll speak to Director of Maternal and Neonatal Health Services from the National Department of Health about accessing prenatal facilities in and around South Africa. And we'll wrap up our discussion with a chat with a doula and childbirth educator who's also co-owner of Mother Instinct about alternative birthing methods. Remember that you can be a part of the show by asking the guests that we have some questions that you have in your mind, or simply share your views on what we're discussing today. The number to call is 011-714-5861 or 011-714-5877. You can also share your thoughts with us on social media using Twitter at SABC Vital Signs, or Facebook is SABC Vital Signs. Vital Signs continues right after this ad break. Stay with us. Welcome back to Vital Signs. Now, once your pregnancy is confirmed, it's important to see your GP or a midwife as soon as possible so that you can schedule appointments, of course, of what you will need. Now, appointments during this pregnancy and, of course, your pregnancy are called your antenatal appointments or antenatal care. Such services are available at primary healthcare clinics as well as private facilities, and we visited the Alexandra Clinic to find out about the services that they offer. Take a listen.
It is important for the pregnant woman to come for antenatal care. That's where we check for STI, any chronic diseases that might affect the babies.
Sister Pindiwe Nkosi is the operations manager at Alex Clinic in Johannesburg. We visited the clinic to find out why do pregnant women need to come for their checkups and what is it that they check for.
We do their vital signs where you check urine for any infection, for any sugar, to check if she's prone to diabetes. We also check for their bloods, which the main bloods that we do in pregnant women do RPR, which we check syphilis. Then we do RH, which we check antibodies, which might affect the babies. It might also lead to miscarriages. We also do HIV testing and counseling. Then if treatment is needed, we do treat. Then we also do sauna if they book before 20 weeks.
According to Sister Pindiwe, women who do not come for their antenatal checkups might be at risk when the time for delivery comes, particularly those with underlying health conditions and those who are living with HIV.
The risk is that you find that somebody come already in labor. We don't know HIV status. We do the HIV status. We find that it's positive. We can prevent mother-to-child transmission within that time. We will give the prophylaxis, but you can't prevent that time. We do birth PCR, then viral load and CD4 count. If the viral load comes high, then that woman is not supposed to breastfeed. because the chances of transmitting to the baby is so high. Then the baby is also given prophylaxis. Then we find that she's unbooked and his previous Caesar, she comes here at the normal delivery clinic. We had to transfer to hospital.
One of the patients at the clinic shared with us how she is benefiting from attending the clinics during her pregnancy.
It was my first trimester. Like, as soon as I know what's in Kulelo, then ngeza lana, then bang buka, then sakala sa processa yonke. It helped me a lot because sengiyazi izinto eziningi, like umntwana mengadlali kwamele ngize esibhedlela, like ama-danger what kwenzakala izinto ezinjalo kumele ngize ekliniki.
Even those who have been attending the clinics, it is important to continue with antenatal care programs to avoid complications.
Then as the pregnancy progresses, you'll find that she develops other diseases like hypertension. It always develops after 20 weeks. So as it develops, we can see that now the baseline BP was this far, now it's so far. So this is pregnancy-induced hypertension. Then we refer to hospital for further management.
Primary health facilities such as Alex Clinic are a good starting point for a pregnant woman. Sister Pindiwe advised pregnant women to utilize these facilities as hospitals are overwhelmed with patients.
At the primary level is where we detect a lot of problems. At the hospital are overwhelmed with patients. You will find that they go there, they say come the next day. We were not seen. Then here we see them, then we write the referral according to the risks. If she's diabetes, we know that she doesn't go to Edinburgh, she goes straight to Johannesburg. We've got the booking system that we use.
For those who are expecting their newborns and do not know what to do, you are advised to go to your nearest clinic and speak to a health professional.
It is best as soon as they find out they are pregnant, irrespective of weeks, whether 1 week or what, they come to the clinic for first visit booking. Then from there we will follow them up according to the Bank Plus guidelines. Then we refer them appropriately. We've got this good service here. We do sonars before 20 weeks. And we've got mentor mothers. We'll assist them with Mom Connect. Mom Connect is a system where they educate them about their pregnancies and remind them with their checkups.
After the break, we continue our discussion around pregnancy and what you should do from the day you find out that you're pregnant. We'll see you after this. Pregnancy Awareness Week takes place in February each year. The primary purpose of Pregnancy Awareness Week is to reduce the number of deaths or complications from pregnancy. The Awareness Week is more about highlighting the importance of making sure that the outcomes of pregnancy are good. And joining us this morning to discuss Pregnancy Week is, of course, someone that has got a lot of experience talking around women and giving birth. Today, most women give birth in a number of facilities and hospitals, and of course, under the care of obstetricians. But some women are considering alternative birthing methods, including midwifery, water birth, and of course, birth at home or in a birthing center. Tertia van der Merwe from Mother Instinct runs a doula service that provides information as well as education regarding pregnancy, birth, and early parenthood in South Africa. She joins us to speak to us about how many women actually prefer this service, and of course, we'll continue our discussion with regards to what to look out for when you say you're getting pregnant or find out that you're pregnant. Tertia, good morning. Thank you for joining us.
Good morning. Thank you for having me.
So let's get into alternative birthing methods. I think this is a popular term that we hear a lot of nowadays, but what does it actually mean? What does an alternative birth actually look like?
That's a good question, because I was thinking the same thing. What do you mean by alternative? So I think the problem is people don't know about all their options in South Africa and what they can do around pregnancy and labor and birth. So in South Africa, you have the government system and then you have the private system. As a doula, I work in both, and alternative maybe birthing Alternatives could be where you can think of water birth, or employing a private midwife, or having a home birth, or birthing at a home birth center, or a specialized maternity clinic. I think that would be seen as an alternative than just the normal private hospitals and government hospitals.
So what does that experience look like? The type of women that reach out to you and say, this is the experience that I'd like to have, what does that experience actually look like?
Yeah, so as a doula, we're independent usually. So the couple employs us, or the mother employs us, and we give them informational support and, educational support, as well as physical and emotional support throughout pregnancy, labor, and birth, and especially helping them keep calm and relaxed, and encouraging them to get good antenatal care, and to make a plan for when baby's there and how that will work.
So when does this process of looking after, or this, when someone decides I want to take an approach that is alternative to what the norm is, when does that process start? I mean, you've mentioned antenatal care, but does your job start the day someone finds out they're pregnant, or only when it's time to deliver the baby and we're planning, let's say, for instance, a water birth?
Yeah, usually when somebody finds out they're pregnant, that's when this whole new world opens up for them, and they start going onto the internet or phoning people, getting referrals, and seeing where they can get the best care. And with social media these days, I think a lot of people get more information than in the days that our mothers gave birth, or myself. And that's where they start investigating, phoning and contacting people like me to find out which options will be best for them. For you, why is it important to have great antenatal care in the process of offering alternative methods of delivery? So that will help them or establish whether they're high risk or low risk, depending on their health, because most of the alternative methods, the mothers need to be low risk in their pregnancies.
What does the low risk entail? So, I mean, is a 16-year-old that's pregnant a low risk pregnancy, or is a 45-year-old that's pregnant a low risk pregnancy? What are some of the factors that contribute to this assessment?
It's more than just age. They also need to go for a health check. For instance, if you have diabetes, it's high risk. If you have twins, it's high risk. If you have high blood pressure, it's high risk. So it all depends on what their doctor clears them for, and that is where we, come in and see how we can help them.
And the process of being a doula, how does that affect the person that's there to deliver the child? I know you've mentioned that you offer support, but what kind of support is available to the person that is currently being seen by you?
If they employ me as their private doula and I form a relationship with them, it helps them have continuity in their care, somebody that's there for them and somebody that they can get to know throughout their whole journey. If I help somebody that only contacts me or that I meet just in labor, like for instance, if I do volunteer work at the government clinics, then it looks a little bit differently, of course, but at least there's that continuity of the same person looking after her throughout labor, and it's not different staff members or different people coming in and out of the room.
And for those that would like to seek alternative birthing methods, what advice do you give?
I advise that they go and find out. There's so many alternative places that they can go to in South Africa. People just don't know about it. If they just Google natural birth or they Google home birth, they'll come across so many other alternatives. And there's an amazing community of private midwives in South Africa, in Johannesburg especially, but all over the country, that provide these services for low-risk women, enabling them to have a nice, calm and relaxed and safe birthing experience.
And I mean, the big question that always pops up is this issue of complications. I mean, if you've planned a home birth and you want to do a water birth and you've got a midwife with you and, you know, all these sort of things that are happening that aren't necessarily what normal people are used to, how do we monitor the progress of a pregnancy in that final trimester when the baby, you know, you're in labor at this point in time? So what goes into monitoring and making sure that we minimize complications?
So before they go into labor, of course, they go for their antenatal care, and there a lot of things can be picked up, and they also not just see the private midwife, they also see an obstetrician for that can be used as a backup, either at a government hospital or at a private hospital. And throughout the labor, they get monitored by the medical staff. And if something comes up, they start making a plan, and then there's always a backup. I mean, that's the sensible thing to do.
Okay, let's talk pregnancy at this point in time. I think it's an issue a lot of people find themselves falling into, where, you know, a lot of people don't generally plan their pregnancies, but you do get people that do plan their pregnancies. So let's talk around your services at Doula and people that have come up to you and said, cool, we've just gotten pregnant. Here we are. We just found out we're 5 weeks pregnant. What are the steps going forward? What's the plan that you generally outline for them as a journey of their pregnancy?
Well, if I'm the first one they contact, I encourage them to find a doctor or midwife that can support them and look after them antenatally. Someone that understands their needs and their desires. And then, of course, depending on where that private midwife and doctor works, that will be their facility that they will go to when they go into labor. And then after that, most women have some, you know, questions, and they might have some fears, and I just help them organize that and answer it in a way that they understand. And that's where education plays a huge role, because that helps them have more positive responses and it makes them understand the whole process. What does emotional support look like in early pregnancy? What are some of the tips and tricks that you give to young moms or expectant moms about what the pregnancy will look like? First of all, a pregnant mom wants to be listened to, so she needs a voice. So to give an opportunity to say how she feels is very important. And then also help them to keep calm and relaxed and make them feel safe. Yeah. Is also important to help with if they go through labor, because the more tense you are, the longer the labor is, the more discomfort you will feel. So there's a lot of things the doula does, not just emotional encouragement, but also physical support. So we do massaging to help release endorphins, and we do some acupressure points, and we use a lot of calming techniques that gets taught to us in training in helping a mom go through the labor, feeling supported, feeling calm, feeling relaxed.
Look, sounds very informative. Sounds like a lot of education goes into what the services that you provide actually entail and the stuff that you have to give out. And I think it was very important to really have this discussion around alternative birthing methods and, of course, the care that comes with a pregnancy. A lot of people don't necessarily enjoy being in a hospital or following up in a hospital. And I think being and going out and finding these alternative birthing methods and, of course, facilities and services is beneficial not only to you, but potentially to your baby too. We continue this discussion. Of course, we're speaking to an obstetrician as well as someone from the National Department of Health around the services that are offered within state with helping you out when you find out that you're pregnant. We're going for a quick ad break. We'll see you after this. Welcome back. This is Vital Signs. I'm Dr. Mosam Tombeni. Now, prenatal care refers to the medical and nursing care for women during pregnancy. The aim of prenatal care is to foresee any potential problems as early as possible, with some women, of course, needing to do all this. Now, do public clinics as well as going out to test for pregnancy is antenatal care services that are free in South Africa. How much does it cost to give birth in a public hospital in South Africa? A lot of questions that you may have in your mind. And of course, prenatal care is provided free at all public health facilities. And here to speak to us about accessing these facilities is someone from the National Department, and this is the Director of Maternal and Neonatal Health from the National Department of Health, and that is Ma'am Ellen Mokaba. Good morning. Thank you for joining us, Ma'am.
Morning. Thank you.
So, Ma, let's get into it. How does one access antenatal care? It's something that we speak about a lot, to say as soon as you find out that you're pregnant, go out and go do an ANC. But what does it actually mean?
The reason why we are encouraging women to book immediately they miss a period is for the baseline assessment to be done so that the appropriate action can be taken. We know those who are pregnant, they can either choose not to continue the pregnancy. They will be channeled appropriately towards the area where they can get the CTOP. Those who want to continue the pregnancy, they will be accompanied throughout the journey of the very pregnancy. And they will be registered on Mom Connect again. Mom Connect is a strategy which is going to share the gestational age appropriate messages to these women. If she's 3 months, for example, she'll get the message for 3 months. If she's 6, just like that. And again, we encourage these women to attend antenatal for 8 times if possible. The reason being, we used to have a problem of hypertensive disorders of pregnancy being one of the first 3 killers for mothers and babies. So with this 8 visits, the bank plus visits, we are sort of, controlling the very hypertension. And by so doing, we are preventing unnecessary stillbirths, miscarriages, pre-eclampsia or eclampsia itself, which at times leads to the loss of the baby or the mother or both. And again, these services that we are offering, they are being offered free in the country, South Africa. We are so generous because we want to enliven the country. That is why we care for the mothers free of charge. And the services are offered for 24 hours. And again, these mothers are getting these services from well-trained healthcare providers, meaning the staff that is going to care for these pregnant women, they know exactly what is it that they will be doing with these mothers and their babies in their tummies. And again, where there's a need for these mothers to be referred further, because at times, pregnancy can go haywire. We do call them the high-risk cases or high-risk pregnant mothers. They're going to be referred to the hospital where they're going to be checked by the specialists, because we want to make it double sure that they come up with an alive baby and they too are being cared for throughout their pregnancy. And all these clinics and hospitals, both public and private, they will care for these mothers, They will give them the care that they deserve. And then where there is a need, as I've already mentioned, they will refer to the next level of care.
Ma'am Ellen, let's talk around the issue that you've highlighted, that you want to have these women go through at least 8 ANC visits, so at least be seen 8 times. Since you've put in this intervention of getting as many antenatal care visits as we possibly can, have you seen a drop in the number of complications, the number of stillbirths, the number of all the problems that used to arise with the implementation of this intervention?
Yeah, if it wasn't for the problem of COVID-19, there was an improvement in the number of mothers who are having uncontrolled pregnancy-induced hypertension. And then again, the very number of stillbirths, the numbers were a bit dropping, even though not high, but they were a bit dropping. Remember, even though we are struggling to encourage those mothers to book at the facilities, we still have those mothers who wouldn't come forward why immediately they miss a period to the healthcare facility because of the reasons best known to themselves. I'm afraid to be saying, the cultural reasons, because it was never researched to come up with the tangible reasons why they don't want to come. They will tell you, we don't want to divulge our pregnancy at its earliest stage to the public. So they want to hide that until they are advanced in pregnancy. So the risk inherent in that is that most of the complications are going to be missed at the earliest stage, because the intention is to spot them early, to correct them, so that the pregnancy can go as smooth as it is possible.
Ma'am Ellen, let's talk around availability and accessibility of the services that you offer. Are these services available to the vast majority of people in South Africa, and is it accessible? So, I mean, can I go there after missing my period 3 days ago and walk in and say, I'm here for this service, and will I be assisted?
Exactly. So when you miss your period, you are free to can approach any health facility, or we do have the ward-based outreach team members. You can touch them and say, hey, this is what I'm experiencing. They will refer you to the clinic so that the sister is going to assess you. They're going to test for the pregnancy. And then if it's positive, then they're going to schedule your visits accordingly until you deliver your baby. Because for each visit, there are some tests that are going to be done. And then there are those which will be repeated with every visit to ensure that we don't miss anything. We don't miss any problem that might endanger the life of the baby or of the mother or of both.
Ma'am Ellen, what services are actually offered by some of the facilities that we do visit? So maybe let's cover primary healthcare clinics that a lot of people would find in their neighborhoods and in their communities, but also let's look at the more regional type services that people could also access. What services do you offer?
The services that we are offering for the pregnant women are that we are offering the very antenatal care services. We will test the blood, take the bloods, test them to check for syphilis. We'll take the BPs to check how high the blood pressure is, because blood pressure, I've already mentioned that we check things like the pregnancy-induced hypertension. If there's one, then we'll deal with that appropriately. So we tested the urine again to rule out some of the complications. We're going to palpate this mother's tummy to check as to how the baby is lying in utero, and then the size of the baby again, and then again as to the gestational age, because at times the mother will tell you, I'm this far. But when we do our estimation of the expected date of delivery, we find that it doesn't tell you what she says, but we do have the skill. We do have skillful people who are properly trained on how best to come up with the appropriate expected date of delivery for the mothers, so that they can be, happy, knowing as to when to expect this little bundle, which is very precious.
So, when should you go deliver, and where should you go deliver a child? A lot of people have this idea that a child can only be delivered in a hospital, because, I mean, that's what we're told. But if you're low risk and you need to go deliver, are all clinics capable of delivering children, or are there specific sites where the deliveries happen?
Midwives are trained. The scope of practice of midwives is the one that really set limits within which they are to execute their daily expected duties. One of them is to deliver women when they are due for delivery. So they are experts when it comes to that. We encourage mothers to deliver at the clinics, not at home, because if you deliver at home, or you take a risk of delivering yourself at home, the possibility is that you might end up having a complication, and nobody will attend to that complication, and it might cause the mother's life or the baby's life, or both of them. So preferably go deliver at the clinic. While you are attending your clinics for the very 8 visits, you will be at the same time, preparing as to where to deliver, the very clinic where you are expected to deliver at, and then what to bring when you are coming to deliver, what mode of transport to use while you are coming to deliver, because if it's not a complication, there's no need to use the ambulance. Ambulance is meant for emergencies. If it's a normal pregnancy, there's no problem in that. You need to arrange transport to go deliver at the clinic, to be delivered by a well-trained a healthcare provider, midwives being the ones that are mostly allocated at the primary healthcare facilities. Some of them are likely to be having the advanced midwives. Those are the specialists when it comes to the pregnancy and the delivery itself, including even post-delivery up to 1,000 days.
Thank you so much, Ma'am Ellens, for really covering the important services that you, as the National Department of Health, are out to provide to pregnant women. As you've heard from her, the moment a period is missed or you may think that you're pregnant, it's important to go out to a clinic and be seen. And then from that point onwards, take it upon yourself to go to your ANC visits so that you are seen by all the healthcare professionals at the facility for them to do an assessment on you and find out if you are low risk or high risk and what your birthing plan will actually look like. We're going for a quick ad break. We'll see you after this. Welcome back. When should you start exercising during your pregnancy? Also, is it safe to exercise whilst you're pregnant? Well, you'll be pleased to know that regular exercise during pregnancy can improve your posture as well as decrease some common discomforts such as backache as well as fatigue. Take a look at some of the simplest and safest exercises that you could do at home whilst pregnant.
Hello guys, my name is Boke Kayamba, a certified personal trainer and nutritionist. Today I am going to be sharing with you benefits of exercise while pregnant and of course show you 3 simple and easy exercises that you can do at home. Stay tuned. So the first exercise that we're going to do is a plie, which works wonders on your thighs, your quads, your hamstrings as well as your bum. So you want to have your legs facing on the outside and then your knees will always follow your toes, whatever you do. One hand on the chair, this is mainly for support. Make sure that your upper body is upright the whole time. So you want to go as low as you can, and then when you get down, you want to pulse for 20 seconds. And then you're going to rest for 10 seconds. So you're going to repeat the whole exercise 4 times, and then you move to the next one. The second exercise that I'm going to do is mainly for upper body. All you need is bottled water. You can fill it up with sand if you wanted to make it heavier. Otherwise, just use any light weights, 1 kg, 1.5 or 2 kg, up to you. All right. So what I'm going to do is put your hands on the side. You're going to maintain the 90-degree angle. Squeeze, add some resistance, and then all you do is lift your elbows as high as your shoulders, and you squeeze on your way up, and then bring it down. You want to squeeze, yes. So you want to have the L's on the inside, and then as well as when you lift your hands. Do this for 20 seconds with 10 seconds rest. Repeat 4 times, and you're good to go. Remember to keep your back straight at all times, so you don't put pressure on your lower back. The third and final exercise that you're going to be doing today is the back leg extension. Just make sure that you're going to go down into your mat, into all fours. You want to have your hand in line with your shoulder and knee in line with your hip. Okay? And then you want to extend one leg out and hold for 10 seconds. Bring it down. You go again, 10 seconds, hold, and then bring it down. You want to alternate the legs. 10 seconds, hold, bring it down. 10 seconds, hold, bring it down. And there you go, guys. Remember to keep it going, keep it simple, and be consistent at all times. Not only are you going to improve your moods, but you're going to feel better, you're going to improve your sleep, and you're going to promote muscle tone, endurance, and strength.
Pregnancy Awareness Week takes place in February each year. The primary purpose of Pregnancy Awareness Week is to reduce the number of deaths or complications from pregnancy. The Awareness Week is more about highlighting the importance and making sure that the outcomes of pregnancies are always good. And of course, it's time for us to have a discussion with our obstetrician, Dr. Tsiamo Nakanyane, who is an obstetrician and gynecologist, around the signs that you need to look out for if you think that you are pregnant. Good morning, Doc. Thank you for joining us.
Morning, Musa. How are you?
Hi, nothing to cry about on this end. Let's jump right into it. How does one establish and what are the signs that you need to look out for if you think you may be pregnant?
Look, the signs are not particularly specific. One of the main things to take note of is one's menstrual cycle. So if you have a regular cycle and suddenly you miss a period, by a few days, that's probably the first thing that should tell you that you might be pregnant. Particularly if you know that within the previous month you might have engaged in sexual intercourse without any contraceptives or protection. The other signs or symptoms that you may have will include morning sickness with nausea and vomiting, feeling of being bloated. Your legs may swell up a little bit, but that doesn't also happen in a lot of women. A lot of women actually can go through the whole pregnancy without any of these symptoms. So the number one giveaway is actually missing your periods. So if somebody is fully aware of when they should expect their periods and how long they take and stuff like that, they're usually the ones who will be quick to pick up on when they are pregnant.
Now, a lot of women have gone out to complain about the fact that they continue to have their period even though they found out that they were pregnant maybe 3 months after they got an ultrasound. Is it a common thing to continue to have some sort of bleeding even whilst you're, still pregnant?
It actually isn't that common. Funny thing is, from what I've noticed is, you find people complaining about these things, particularly on social media, and because it has happened to one person and it attracts so much attention from many people, it seems like it's a common thing. It is not common for women to actually continue bleeding while they are pregnant. But if you are pregnant and you bleed, it is a concerning sign. I would advise that you go see a healthcare worker or a gynae just to check if everything is fine there, and it could be one of a few things. So I'm not going to really dwell into that. But the thing is, if you do bleed while you're pregnant, it is important that you actually go to the doctor to check if everything is fine. Yeah,
for sure. Let's jump into, after getting that pregnancy test, it comes back with 2 lines and now you are then pregnant. What steps do you follow following that positive pregnancy test?
The important things. In fact, it's just that most pregnancies are generally not planned, but there are a lot of them that are. So one of the important things to have in your pregnancy is to take your pregnancy supplements, in particular the folate, which you actually need to be taking before you fall pregnant. So if, however, you do find that you're pregnant before you are taking these, it might be prudent to actually start with your first visits to a healthcare facility or a midwife-run unit so that you can start with your pregnancy booking. There are things that need to be done, obviously, in your first booking, risk stratification, to see if there's anything to look out for, in particular to the individual that's coming for that pregnancy checkup. If there's a need to do an early ultrasound and stuff like that.
Is it too late sometimes to go sign up for these antenatal care visits? So you'll find sometimes that people say, well, I didn't know I was pregnant. I just thought, my cycle is going haywire. And now I'm 5 months pregnant. I can see a bit of mkabanyana. Am I pregnant? Is it too late to go sign up?
Look, it's never too late. However, it is preferred that you start your antenatal booking in around 10 to 14 weeks if you are keeping track. But if you come later than that, it's not a train smash. it obviously just makes it a little bit difficult to manage complications if you only start booking later in pregnancy. The non-complicated pregnancies, even if you start booking at 30, well, I'm not advising that people book late. What I'm saying is even if they come in late and it's non-complicated, it won't be such a train smash. The problem comes with complicated pregnancy when a patient comes first time at 34 weeks. Now, you don't know how far pregnant she is. There's this particular complication that you may need to deliver or not, and you need a reliable gestational age, how far pregnant the patient is, for you to make your decisions. So it is very important to book early. However, you can never say it's too late to start your antenatal visits. If you only find out that you're pregnant at 34 weeks, the advice is go to the clinic, let them assess you, and so that everything can be done. If there's something to be picked up, even though it's late, then it can get managed before you get to deliver, because there's a lot of complications you can avoid if the problems are foreseen earlier before the delivery.
If this is not your first child, so you've had 3-4 pregnancies before that were successful and were low risk each time, is it important to keep booking at antenatal clinics, or can you forego that sort of idea because you're a veteran of sorts at delivering babies?
The pregnancies are different from one individual to another, from the same person, but just different pregnancies. Your first pregnancy will never be the same as your fourth pregnancy or your eighth if you push that far. There's new risks which come with the difference in age. There's new risks which come with the repeat in your pregnancies and stuff like that. So whether it's your first pregnancy or your fourth pregnancy, it is important to actually follow up and do the antenatal visits and everything like that, because certain complications may come only with your third or fourth pregnancy. And also some complications, because they're associated with age, they may only come with your later pregnancies than your earlier pregnancies. So it is still very important to go for your antenatal visits, regardless how many pregnancies you've had before.
So pregnancy has been described as having 3 trimesters, where you expect different things in each trimester that you currently face at the time. What are some of the common problems that women can expect in each of the trimesters?
Sure, there's a lot. The problem with the first trimester is usually miscarriages. That's probably the most common thing that that may occur. Actually, a lot of women end up with miscarriages. So that's why, again, like I said, it's important if you're bleeding, if you're pregnant, you're bleeding, it's important to go for a checkup. The other thing may be an ectopic pregnancy, but those patients usually present already with symptoms of pain and bleeding, and they end up in an emergency unit. The other thing is the morning sickness, which can be severe. That's when we now call it hyperemesis gravidarum, which is now pathological and it needs to be treated medically. Second trimester, they usually go well. The only, I think, big issue here is the things that we pick up during the pregnancy. Towards the second half of the second trimester, after 20 weeks, you now start seeing different complications which may arise with the pregnancy, development of first-time diabetes, hypertension, high blood pressures developing the first time in the pregnancy. This is now the hypertension and then your preeclampsia, which may complicate it with eclamptic fits. So a person will have convulsions, and that's actually usually an indication to deliver. You may have other problems which affect the baby inside the womb, like baby not growing well, or maybe having preterm labor. There's a list of things that could go wrong with the pregnancy. That's why it's important to go for your antenatal visits. I could literally go on with the list. The issue is it's important. That's why I need to emphasize also the importance of following up with your antenatal visits so that these things can be picked up if they can be picked up on your visits. And once they're picked up, then we know how to manage them appropriately for the best outcome.
Let's talk around you getting to the third trimester. You've got a healthy-looking 37-week pregnant woman and has had no complications, and it's now time to deliver. Who decides what kind of delivery you get? I mean, a lot of people have spoken about Caesars, natural delivery. We had someone speaking about alternative birthing. So who decides when you get what?
Look, the right thing to do, the decision literally lies with the mother. However, the mode of delivery also depends on what is available to her.
Okay.
So generally, the advice would be go for normal vaginal delivery. If it's non-complicated, you haven't had a previous Caesar, we're not expecting any complications with this current pregnancy, it's better to just go again for a normal vaginal delivery. In our government settings, that's generally the approach. And if we do offer a cesarean section for delivery, it's always indicated. It's always a clinical indication where there's some form of complication that's occurring either with the pregnancy itself or the mother, the baby, or with the labor itself. So those decisions are made obviously by the mother, but they are given as advice from the caring clinician. So if I'm the doctor who's currently taking care of a laboring patient or a patient in the antenatal visit, I advise accordingly as to, from what I find, if it's a low risk pregnancy and I'm not expecting complications, I'll let her know that it's okay for you to deliver normally. If there are things that I pick up that require a cesarean section delivery, then I advise accordingly also.
Okay. And lastly, is there such a thing as eating healthy within a pregnancy? A lot of people will speak to this idea of gaining a lot of weight when they were pregnant and, that came from, I don't know, whether it's cravings or whatever it might be. Is there such a thing as, having carrots and, yogurt for breakfast in your pregnancy and that being healthy versus amakwinya and paluli?
Look, it's always advised to stay healthy during your pregnancy. When it comes to healthy eating, there's a lot that comes with that. There's, again, sorry for that.
No worries. Good. All right. It seems we've lost him, but I think he really did cover a lot of the topics that we really wanted to get into today. And of course, looking at this idea of pregnancy, all the good things and all the bad things that could happen with a pregnancy and what you should do if you find out that you are pregnant. I think the theme that ran throughout the show today was this idea that the moment you miss your period, go out and go get a pregnancy test just so that you can find out if you're pregnant or not. And if you are, so you can start your antenatal care journey. And thank you for joining us today as we took you on a journey of pregnancy. I hope that it was insightful and that you received all the information and knowledge to take the step as you go into the future. Planned or unplanned or whatever it might be, make sure that you take care of that little one should you want to have a little one in the future. Thank you so much for joining us. I'm Dr. Mosam Tombeni. Remember to stay safe during this pandemic and we'll see you again soon.